Nigerians, you are welcome to Talking Health with Dr. Laz, your favorite health program on television. As you can see, this edition is coming from you. We're on the streets. I'm in Abuja. This is Area 1 roundabout. You can see the environment. You could see the decorations at my back. You could see the green, white, green decoration. It's still 60 years of being together in the country, and it calls for a lot of excitement, even though we have a lot of challenges, especially in the health sector. But we have made some progress, and we must acknowledge, yes, that some progress have been made. Nigeria health sector is far behind where it should be, and we are going to be looking forward. So we go to different parts of the Federal Capital Territory. We are going to ask questions to people. What do they want to see in the next 10 years? By 2030, where do you want our health sector to be? And as we ask these questions, please also share your opinion, your responses on our various social media handles on Twitter, Facebook, Instagram, at Talk Health Niger, or even our YouTube at Talk Health Niger TV. So we are going to be talking to a lot of persons. In malaria, we are the #1 in the world with the highest burden of malaria. In TB, we are among the top 5 in the world with the highest burden of tuberculosis. Also on HIV, we are in the top 5. We, in the past few weeks, just last month, we overtook India as a country with the highest number of children under 5 years dying. When it comes to women dying for pregnancy-related issues, we are also like #2, second after India. So our indices are not saying good, but we have to look forward when we'll be celebrating 70 years by 2030. Also, when the Sustainable Development Goals, will be ending, where are we going to be? So we want to hear from you. So keep watching. We'll take a break and we'll be right back. Keep watching Talking Health with Dr. Laz. See you after the break. Thank you. Welcome back to Talking Health with Dr. Laz. We are on the streets and we are going to be hearing from Nigerians the assessment of the healthcare sector as Nigeria marks its 10th independence anniversary, as well as their recommendations so that in the next 10 years, we will be doing 70 years, we'll have something better. So let's hear a good number of Nigerians talk about it, and we'll keep the conversation going.
The health sector, I think we had reasonably done very well. On a scale of 1 to 10, I will put it at 7. 7 in the sense that looking at the history, back then from the then Ebola, polio, and all of that, and even only recently we were out of polio eradication. I think that's reasonably okay. Of course, it is even better to compare ourselves with a developed country than comparing ourselves with a lower country. We are better than some countries. That's just what I want to say.
The issue is that we needed to improve in our health sector. For example, like during that COVID, we don't have the equipment in our own country. So we needed to improve more on our health sector, because even in some hospitals, if you go there, you will not see drug, you will not see they will give you written notes to go outside and buy your drugs, and which is not supposed to be in a country like Nigeria. So we needed to improve.
The health sector in Nigeria is quite deteriorating because this is a country that leaders are not capable of thinking. Why? Because we still have the same old carcass, expired leaders who rules. Even when I was a child, that's at the top of the affairs, at the aim of affairs. When I was in secondary school, I was in class 2, and that time they said there will be health for all Nigerians. So there was high expectation 2000 came, nothing on ground. Do you know that Nigeria is rated among the country with high maternal deaths and infant mortality in the world? Why? Because the leaders are not planning. They are only thinking about politics. Who is going to rule in 2023? Who forms party? What do they need to do? So in totality, the country is very sick. Not to talk about health sector. Go to hospital, you see people scrambling to access Panadol and some drugs. It's not there. Not even beds.
They are facing more challenges than the better outcome. But for being a great country like Nigeria, we've been able to do some things right. Like the time that we defeated Ebola in 2015. Recently, we were declared a polio-free country. And right away, we've also fought guinea worm and we won it. But this time around, our country has been facing more challenges, more especially when it comes to maternal child mortality. In this country, it's not encouraging.
You asked about Nigeria celebrated her 60 years whatever. Yeah, I don't know if we celebrated it. If we wish to say we celebrated it, good and fine. But to me, there's nothing to be celebrated there. We didn't celebrate anything. Only that we only heard that Nigeria is 60 years. Nigeria has been 60 years without any achievement. It's like we are still wearing a baby wearing pampers. Nigeria is still wearing pampers as of today. And that is the truth about. Well, I would say Nigeria have achieved anything there. For instance, I reside here in Abuja. If you go to National Hospital, nothing to be written home about. It's just 0 points. To be honest with you, to compare with other countries. In terms of health scheme, NSH or whatever. Yeah, I learned that the minister and the secretary or whatever, they're in a loggerhead. And the thing affected we Nigerians and those in that HNS, which is not supposed to. And as I'm talking to you, if you go to hospital now, in fact, if you go to hospital now, what you see there is not what we expected. I'll take for example, somebody who want to give birth, who want to deliver, went to hospital. They refused attending to that person. That person now came back and went to Park Hospital. That's why she delivered.
Health sector, to me, they are not doing well. If you look at the milestone where we have gone today, ranging from our independence in 1960 till now, our health sector, they are not doing well. Primary health care in the rural areas, we have nothing. You travel to our villages, you see the pregnant women, old people, aged people. There is no plan for them. They are suffering. For them to access health facility, there's some travel up to 5-10 kilometers for them to attend to their health. So, to me, we have not done well at all in the health sector in Nigeria.
So what are your recommendations? Where do you want to see our health sector in the next 10 years?
The whole thing,
what do you think governments can do? And everybody, not just government.
The whole thing still boils to corruption, to me, because the government is doing well, the politicians, they are doing well today, they know they can invest. They have the political will. If they have the political will to invest in health sector today, believe me, people will not be traveling outside. Imagine South Africa. Our doctors here are traveling to South Africa. What I think the government should do now is to invest massively in health sector. Building hospitals, world-class hospitals, not just hospitals, because they have the capacity. From urban areas to the rural areas. That's why we have primary health centers. So we have primary health care to the rural areas so that everybody will have access to health facilities. Thank you very much.
Thank you, sir.
God bless you.
Nigeria have done so well in some aspects of health. Basically, just of recent, Nigeria defeated polio. That's a milestone. And then we also defeated Ebola in this same country. And then in routine immunization generally, Nigeria is doing so well in routine immunization generally. But there are lots of things Nigeria we still need to put in place.
Nigeria needs to improve on their health sector now. Mostly doctors, sometimes they used to complain that they used to attend to the patient. So Nigeria need to improve the health sector honestly, so that if patient comes, not only one doctor will attend to the patient, like one or two doctor should attend to that patient. So, and they should be at work as the thing was written in their book.
Done well at all. Never ever. Why? Because our leaders travel overseas for their health care with their children, with their wife. When their wife want to born, they send them to America. Meaning that they want to leave Nigeria, their home, as a state of squattered environment devoid of anything, medication or structures that have to take care of healthcare delivery.
Our government or people that are on the top, instead of investing our money in outside country, it's better they invest it here in Nigeria, especially in health sector, because as they say, health is wealth.
For me, 2030, that's 10 years from now, is too much. I would want the health sector to get us to a situation where we won't have any reasons for people traveling abroad for medical attentions, and rather we want to see people coming into Nigeria to seek for health care. So I think the government really need to put up a lot of efforts in training and retraining our medical personnel, and of course equipping our hospitals, especially I don't know how to put it, the remote area of our country. We need to see how the health care is improved right from that angle. And
Health insurance scheme, they are not really doing well to accommodate every population, the whole Nigerian community. So I think they have to really enlarge the scheme to accommodate all Nigerians. That's what I feel they need to do. Then about the health tourism, I feel Nigeria should do well and improve our health sector so that health tourism will reduce in Nigeria. That's what I feel Nigeria should do in the next 10 years.
I believe the present government, if they will invest more in our health infrastructure, it will go a long way making our elites and politicians to stop traveling abroad to seek for health assistance. You see them spending money for health tourism, because doing that they are moving wealth from Nigeria to other countries, investing in their health sector. But that money, the Nigeria have the capacity, because we are blessed. You see our oil sector and other things. The money we are generating in our country today, if they invest it in the health sector, it's going to go a long way.
We normally deceive ourselves with the word, "It's not my business." Health, they say, is wealth, and it's everybody's business. Because I as a student, if I'm not healthy, I can't go to school. So we need Nigerians to focus in more practical aspect of studies. When we study sciences, we do it practical, so that we will learn it. And we need to base all our recruitment based on professionalism. It will be very, very fine if Nigeria put it in place that everybody that will assume any position in the country must be expert in such field. So I believe that when we do adequate funding and as well good management, that Nigeria will come out successfully. Though 2030, I'm expecting Nigeria to remain the giant of Africa in their health sector. I don't want to be experiencing this health tour or that. No. I want Nigeria, let's be better in our health system. Because
my recommendation is, they should allow young people who are competent to come into power and stop this ethnic chauvinism in power and also things that has to do with sectionalism.
Move forward is number one, prayers number one. And secondly, that ant that is being beating us, that ant have been beating us, and that ant of corruption that have been beating us have also beaten that sector. Therefore, if that head is not good, how would you want the tail to be good? Moving forward is for us to start from the top. I get my point. Let us know that this country belongs to all of us. In terms of that health sector, let the minister know that sending other people visit the hospitals, one hospital to other hospitals. Secondly, if he is appointing, let his appointment based on your qualification, what you read, what you are capable to do. Not just because you are my brother, not because I know you, you are now appointed to be an national hospital, not appointed to be this. Everything will be zero.
What I think the government should do now is to invest massively in health sector, building hospitals, world-class hospitals, not just hospitals, because they have the capacity. From urban areas to the rural areas. That's why we have primary health centers. So without primary health care to the rural areas, so that everybody will have access to health facilities.
Resource for health should be also improved in Nigeria. If we do it, I think Nigerian health sector will go well in the next 10 years.
In the next 10 years, yes, I want us to be at the beehive of a country where people come in to take medical attentions.
Nigeria to be good in the next couple of years should be greater than this. That's our prayer.
Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, we used the first segment to go to the street, and I'm sure you got a lot of insights from the opinion of Nigerians on what they think about our health sector as Nigeria celebrates the 60th independence anniversary, and also where areas they needed improvement. Right now I'm at Wuse General Hospital, Wuse District Hospital here in Abuja, and I'm going to be speaking to an expert. He's the president of Association of Resident Doctors in FCT, and also works here as a surgeon. So he's going to be sharing his insights, not only as a clinician, but also on different aspects of our health sector, what we need to see by 2030 in Nigeria's health sector. Please stay with us. Dr. Roland Aigbovo.
Good evening.
Yeah, good evening. Pleased to meet you again.
Thank you very much.
Yes, welcome to Talking Health with Dr. Laz. Nigeria just marked the 60th independence anniversary. Yeah. And on this program, we are putting into focus the health sector. So we want to know from you your assessments from a professional perspective, and we'll take it off from there. How do you assess our performance in the health sector in the past 60 years as a country?
Well, I actually don't want to be sounding like a broken record. There have been some, let's say, some little advancements, and also largely I would rate it very, very low, because taking a look at the health sector holistically, you find out that not much has been done. I would say, one, in the area of infrastructure, and also in the area of human capital development, and even in the area of the primary health care. Because for me, the primary health care sector is almost non-existent, because nothing is being done in that part. Of recent,
are you sure nothing is being done? There is policies on primary health care. There is a lot of investments at the state level. There are a lot of the Millennium Development Goals. You know, Ransom Kuti as minister did tax shifting, and you know, a lot of persons. So, are you really sure nothing has been done so far?
Well, like you mentioned, policy. One thing I know Nigeria we are very good at is developing policies and templates and stuff like that, but implementation has always been the problem. Now, if the primary healthcare sectors, the primary healthcare, which is the primary level of care, is functional, there won't be too much pressure in the secondary level of care and even tertiary. Situation whereby somebody that is complaining of headache or minor ailment, you need to come to a teaching hospital for that. Of course, that should say that there is failure. And now, the primary healthcare is under the local government. Even the local government are even struggling to survive, not to talk of having to even feed or take responsibility for the primary healthcare system. So the primary healthcare system is almost non-existent. And then in the last few years, there was this idea of trying to bring up the primary healthcare, like the launching of the Kuchingoro and all of that. After that, of course, everybody went back to sleeping mode. So for me, the primary healthcare, where even anything is done, whatever is being done is not substantial. It's very, very insignificant, even with the SDGs and all of that. There might be pockets of programs trying to palliate the whole situation, but by and large, put all these things together, what is the effect of all these actions towards the health of the people is almost not there. So that was why I concluded that the primary healthcare sector is almost non-existent.
Okay, to solve that problem of local government fragmentation in primary healthcare, I think they came up with the primary healthcare under one roof. Yes. You know, so states now have an agency that is in charge of primary healthcare, and that has helped to solve a lot of coordination issues. But let's move to another point. As healthcare practitioners, many Nigerians think we are part of the problem. Do you agree with that?
Well, I will tell you yes, and I will also tell you no. Yes, because I won't say that we are completely immune or we are completely out of the problem. We as healthcare practitioners, we also have our own problem. We also contributed to the level of which is in. For instance, every now and then, we have the issue of the strikes action, which, of course, the people will definitely say that, oh, doctors or healthcare workers are not supposed to go on strike and stuff like that. Even though the strike actions was actually to demand their entitlement, but I believe there are much, much better ways to address issues other than going on strike, personally. Then secondly, you know, we are also pushed to the point that the government of the day or the government of Nigerian government across board, the only language they listen to is strike action, which is not supposed to be. That's on one part. Then secondly, we also have our own attitude to work. I will also say that. Healthcare practitioners, we have our own attitude to work. Situation whereby somebody is supposed to be at work by 8 a.m., you are coming in around 10, 11, and by 1 o'clock you are out, or you are supposed to be on call or returning particular post, your duty post, you are not there, and all of that. So all these all contribute to, because we've lost lives just because somebody was supposed to attend to someone and the person was not there at that point in time.
So how do we move forward from here? In 2030, the Sustainable Development Goals, you know, we have health targets. So what are your recommendations going forward as a nation to health workers, to the government, to the people?
All right, yeah, the issue of interprofessional rivalry, we're actually going there because that's actually another major issue in the health sector that brought a whole lot of trouble in the health sector, where everybody is looking at, oh, because I'm this, I should get this, or because I'm that, I should get. No, for the whole of to actually manage this interprofessional rivalry or to maintain that interprofessional relationship, the government is key. The government is key because the government employs everybody. So a situation whereby you know what to do and you are playing politics with it is actually what has dragged us this low. Because like you said, we have documents, we have policies, we have laws and all of that, yes, that back every action of whatever, whether you're a doctor, you're a nurse, lab scientist and all of that. We have schemes of service that everybody should know what's their responsibility.
So what specific action do you want government to take to sort that out?
Okay, a lot of issues that, for instance, you have the Ayale Ahmed recommendation, okay, which is a government document, which up to now is yet to be implemented. That's on one part.
What does that document say?
Well, I think the content of the document is actually more or less like a job description for each of the responsibilities of every healthcare worker, and you should know your boundaries. Now, going to the most of the one that is more popular, the issue of the Decree 2 or thereabout of that place headship of hospitals and doctors and say you are medically qualified, which other healthcare workers are contesting that they should also be at that level and all of that. If there is a law that states that, so why would anybody want to go on strike to change that law? Until that law is repealed, that law will continue to take effect.
I think that's a good point to end the program. I've been speaking with Dr. Roland Aigbovo. He is the president of Association of Resident Doctors in the Federal Capital Territory Administration. He is also the treasurer of Nigerian Medical Association in FCT, wearing a lot of a lot of caps, and he's been speaking to us about what he thinks we need to do going forward to make our healthcare system stronger, at least looking at the next 10 years for this country. So do not hesitate to follow us on our social media handles and share your opinions as usual, and we will always find time, to respond to you. You'll be watching Talking Health with Dr. Laz, and I thank you for staying with us. Same station, same time next week. We will still be with you. Thank you. God bless you.